Hello, my name is Dr. Mark Stid, and I'm a family practice physician and one of the members of the Holland Hospital medical practices. I'm here with three of my colleagues to talk about one of the most controversial topics related to COVID is what to do over the holidays. So I'll let them introduce themselves first.
I'm Michael Ridding in Pediatrics and Internal Medicine.
I'm Dr. Chris Howell with Internal Medicine.
I'm Dan Maring with Family Medicine Zealand.
So as we all know, families are very important during the holidays, and we usually like to get together in large groups and just hang out and do things. And unfortunately this year, we're afraid that just carries an extra layer of complications. And so we would like to just talk about some of the things that you might want to consider as alternatives and in turn avoid infecting family and friends on a more regular basis. So any suggestions that you have, Michael, as far as from your family standpoint?
Well, my family, we're a little bit hypochondriacal anyway. So I'm kind of looking at this as a positive in a way, in that if you're sick, of course, you are not going to go, you should not go to a family gathering. And that's going to, that takes some discipline. So if you're starting to have a sore throat or other problems, you can't go, even though you may really want to go participate. The other thing is, we don't want to spread coronavirus, of course, but we also don't want to spread influenza. And it's just as important, especially with elderly family members, that you don't spread the flu. And you can do a simple flu shot, and I recommend that for everyone that is anticipating any kind of family group get-together. And just from my standpoint, I am from Texas. I'm going to travel down to Houston for Thanksgiving, but we're having all of our things outdoors. We will, and you can do that because it's not freezing down there, but that's another option, is if you can get outside. I still think that's the best way to try to get together.
Okay. And Chris, you have younger children, which of course means grandparents want to be around them. What are some of the things you're trying to do to prevent problems?
Yeah, for those of us without the luxury of being in the Texas sunshine, the reality is most Thanksgivings, outdoor celebrations, outdoor dinners are not going to work in Michigan. And I've heard so many very good creative things from my patients because they're worried about this. And, you know, the classic one is we're not going to have, you know, the dinner and we're going to see each other on Zoom or Skype. But I recognize there's something to be said for seeing each other, for saying I love you face to face. And I think we have learned enough about COVID to know there are safe ways to do that. You know, shorter visits where everyone is masked up for, you know, Thanksgiving, Christmas, you know, passing out some presents. These are not the typical family time that, you know, we expect. I recognize that, but I don't think that staying completely separate is absolutely necessary. Now, however, there are some pretty strict guidelines on this. You know, what do these visits look like? They're short. They're masked up, everyone. The grandkids are masked up. The seniors, the grandparents are masked up. And you know, we're probably not passing the gravy boat around. There really is no way to have a Thanksgiving dinner with a large group of family safely. I have some patients who have Thanksgiving is very important to them, and they found out ways to actually quarantine pretty strictly for 2 weeks prior to this get-together. And I think there are ways to do that, but the vast majority of families with children, with working young adults, are not going to be able to do that. And looking to these shorter visits, still meaningful, still face-to-face contact. I realize it's not the same, but we all want Thanksgivings for years and years to come with our older relatives.
Okay. And then Daniel, you have you and your wife just recently married. How do you handle all the in-laws and the visits that they would like you to, appearances they would like you to make?
I empathize with families. Over the last several months, people have gotten lonelier. People are thirsty for social interaction and life to return to normal. And so, and all of this feels foreign. Even wearing masks with family members feels foreign. What our strategy is just to have an open dialogue with family members before the event and presumably well before the event, so that everybody can get on the same page. What is this year going to look like? How are we going to love each other by protecting each other to some extent? And Thanksgiving and Christmas can still feel joyous and fulfilling, but everybody has to be on the same page about what that looks like. whether it's wearing masks indoors and keeping visits brief, or trying to be perfect in your pre-event precautions. I think it's very important to just have open and be charitable with one another and encouraging, so that this holiday season isn't the one remembered as the worst ever, and that we can still have great holiday celebrations.
All right, thank you. And I personally have 2 children that are in college and one that is teaching in a school, so unfortunately all rather high risk for bringing things in. And so we are trying to figure out a way to combine a couple of families with kids in that age range, and honestly giving some people a pass if they're uncomfortable, and trying to schedule it so there's just a limited number of people at one time. So again, there is no perfect answer, but it still has to be something you can consider, and just ignoring it and trying to have the traditional Thanksgiving dinner and then, Christmas celebrations are going to be problematic this year. So we would ask that you put some thought into it, and certainly you can talk to your physicians if you have questions on specific things, and or if it's a major issue, we do have some behavioral health specialists in each of our offices to kind of just talk some of these things through.